Hey, my name is Adam Cleveland. I am an occupational therapist here at Excel Rehab and Sports in Easley, South Carolina. And what I want to talk to you today about a little bit is some exercises and stretches that you can use to help with some postural deficiencies. Nowadays, it seems with the information age and the computer age, we find ourselves so much in a forward postured position. I don't know about you, but I spend a lot of my day when I'm doing notes like this and in a forward tilted position with my hands on a keyboard when I should be up here. And whether that's being on your phone and slumped down or in front of your computer or possibly maybe sitting down, lounging in front of your TV, any of those positions that you're going to be in for an extended period of time that places you in a position of poor posture can really start a lot of negative things. And what I want to talk about today is how that poor posture can start to affect the shoulder girdle. So deficits in upper trunk mobility, especially poor posture, can lead to a forward drift in the shoulders. Over time, as we spend more and more time with things in front of us, our pectoral muscles and these things, muscles in the anterior quadrant, start to tighten up and pull the shoulders forward. In addition to those muscles tightening and drawing the shoulders forward, we get an overstretching of the muscles in the back, the rhomboids, the middle trap. Those muscles start to overstretch and lead to that imbalance. As this happens, the shoulder blade is going to start to tilt forward. And there's a bone on top of the shoulder blade, part of the scapula, it's called the acromion. As it tilts forward, it's going to kind of point down into the shoulder joint. That poor posturing of that bone, the scapula, as you go to raise your arm, there's not a lot of room now because that acromion has tilted forward and it's going to cause impingement. So it's important to maintain upper trunk mobility, especially postural correction exercises, to keep that scapula back in place, stretch these tight muscles back out, and start to work on the tone and strength of those muscles in the back that I was referring to earlier, the rhomboids in the middle trap, so the scapula are more postured correctly. So the first of these exercises is upper trunk rotation. And what you're going to do is sit at the very edge of your chair, and I'm on a swivel stool, but you're going to sit at the very edge of your chair, place your hands across your chest, kind of lock down the spine, and you're going to leave your knees planted, or your feet planted about shoulder width apart with your feet flat on the floor. And we're going to rotate to one side and then to the other. We want to hold these stretches about 30 seconds. And we're going to do 5 to each side. And I'll demonstrate that for you now. We'll go to the right first. And what you want to do is, leaving your feet flat, is try to rotate the upper trunk as far as you can, including the neck and head, trying to glance over that back shoulder. And you'll pause, try to breathe normally, and hold the stretch for 30 seconds. Now, it's important not to overstretch. You don't want to feel any discomfort in the spine, nor any cramping in the working muscle group. And you'd be surprised, especially if you don't do this stretch very often, or if you're not used to moving in that direction, how little effort it can take to cause a cramp in that working muscle group. Now, the second stretch that I'd like to do is called a thoracic extension stretch, and I'll show you that here right now. You'll need your high back chair and a towel roll, and this is just a regular bath towel that's been rolled up, and I've got a little athletic tape on it. You don't necessarily have to tape up one, but it's good to have, especially if this is a stretch that you like to do and you want to do often. We're going to set this towel roll right across the shoulder blades in the back. So we're going to come straight back behind, right across the shoulder blades. And then once again, to lock down the spine, we want to cross the arms across the chest, and then I want you to arch your back just from the shoulders, and to protect your neck, I want you to keep your chin tucked in towards your chest. So it looks like this. We're going back, and we're going to hold. We're going to hold that stretch up to 30 seconds, and we'll do that 5 times and repeat. Just like the previous stretch, we want to take this to a position where you do not feel pain, only a stretch and maybe some slight discomfort, not sharp pain. This final stretch you can do seated at the edge of your chair, and this is going to incorporate the muscle groups that are in between the shoulder blades in the back. So we sit like this and all those muscles get stretched. During the day, we want to take breaks and exercise those muscles and bring them back into positions where they're being worked so they don't atrophy and create this forward postured position here. So retraction and depression is the term we're going to use here. It's bringing the shoulder blades together and down towards the spine. I'll show you from the front, and then I'll show you a common mistake that people do. So we're going to sit nice and tall, good posture. You can rest your hands on your lap, or you can cradle your arms, either way. But we're going to bring the shoulders down first into depression, and then we're going to roll them back. We want to hold that contraction for about 5 seconds, 3 to 5 seconds, and then relax. And we're going to want to do that 10 to 15 times, depending on how it feels. If it's uncomfortable, you may want to stop at 10. If you're feeling good, go ahead and do 15. This is more of an exercise than a stretch. So once again, we're bringing them down and back, holding for 3 seconds, and we're repeating that 10 to 15 times. Now I want to show you something real quick. It's a common mistake people make. I'm going to turn around. A lot of times what I see people do when they do this exercise is that they start to bring their shoulders back, but instead of keeping them down, they shrug and they end up coming up into this elevated position here. That's only going to increase the amount of tension and discomfort up in your neck and can contribute to tension headaches and things like that. So you want to make sure those shoulders stay down and relaxed as you perform retraction, and that those shoulders don't start to elevate. And once more, all of these exercises, you want to make sure that they are pain-free. There should not be any sharp pain or anything like that. You're only going to feel like some mild fatigue, like with the exercise I just demonstrated, and then some stretching-related discomfort, but no sharp pain with those first 2 stretches. Thank you.